Today, Dr. Tara Abraham joins me to talk about her gynecology career and her new boutique women's health gynecology practice. Thank you so much for joining me today. And my first question, pretty basic, but can you tell me a little bit about your journey into medicine and how you chose to go into obstetrics and gynecology?
Thank you, Polly, for having me. My journey into medicine and into OB was really circuitous. I always knew I wanted to do medicine because I really liked the problem solving, making connections with people. When I thought about having a job, I thought about what's going to get me up every morning and into the office. And so in college, I did a whole lot of different things. I majored in biology eventually, but I was really interested in a lot of different things, which also, made me, I didn't go into the traditional route of medicine. I actually ended up, right after college, I did a master's in public health.
Nice.
I was really interested in infectious disease. So,
a little bit different from gynecology.
Yeah, a little bit different. Well, but also the same, right?
Yeah.
Bacteria, viruses, all of this stuff's totally relevant. And so I did a master's in public health at Yale and majored in the epidemiology of infectious disease. But I also thought that was really important in terms of understanding medicine. I look at public health as like the umbrella over medicine, right? So it's like, how to read papers, how to understand the numbers, because there's a lot of different ways you can interpret things, as we're seeing, nowadays. And so I did a master's in public health, and that's when, I sort of realized that field just wasn't enough. And so I studied for the MCAT, and I took the MCAT. And while I was waiting for my acceptances for med school, I ended up getting a job as a healthcare consultant for a major health insurance company. And it was basically healthcare consulting. And that was a really good experience to see the business side of healthcare. And it was also enough to let me know that it was not something I could do every day of my life. And so the choice to go into medicine and actually take care of people on a day-to-day basis, that's what's going to motivate me to go into the office. OB-GYN was a whole different, I actually never expected to go into OB. It really, I loved when I became a med student and we did rotations, I really loved medicine, the problem solving aspect, and, trying to fit all of these different sort of aspects into one big picture and one diagnosis. It was really interesting to me. And also the type A aspect of it. Like, I like the organization and like seeing all my patients, making sure to follow up on the labs, like sort of keeping everything in check. But medicine just wasn't enough, and it didn't have enough procedures at the time for me. So I also really loved surgery. And so to the point where I thought, okay, well, maybe I'll go into general surgery. But then, and so I left OB-GYN for the last rotation of my third year, thinking I would never do it because, I didn't know anything about it actually. And then ended up going into it, the rotation, realizing that it was just the best mix of what I loved about medicine in general. So I loved, internal medicine, problem solving, I also loved forming those connections with people and spending time with people, talking to them. But I also loved surgery. So, when it came to that rotation, it was a very natural sort of like fit for me. And which was surprising. Which was really, really surprising, actually. And, OB-GYN is notoriously very difficult because you have to be someone that manages a lot of things at the same time, and you have to love that. So I loved the chaos. I loved the triage, what is, where to fit what in and when, and how to sort of manage all of these different things at the same time.
Nice. So, and so I know you're not practicing in a traditional sense as a gynecologist, but can you take me back and describe what a day in your life would look like?
So when you say I'm not practicing in the traditional sense, it's because I'm starting my own practice.
Yes.
Right? So it's because I left obstetrics in basically the end of November, early December of 2024, so 6 months ago. But in general, as an OB-GYN, obstetrics and gynecologist, my day-to-day was I was in the office 3 days a week. I saw patients from 8:30 to 4:30ish, and was probably there longer after that, taking care of different things. But I'd see people for not just obstetrical reasons, but also gynecological reasons. So I'd see people, before they wanted to have a baby and talk to them about preconception. I'd see patients that were pregnant at various stages of their pregnancy. I'd also see people that were struggling with fertility, or I'd see people that wanted to talk about contraception, or I'd see patients and talk to them about perimenopause and menopause, as well as their bone health. And one of the biggest things, which sort of ties into my public health background as well, is I'm really passionate about preventive care. So I do a lot of talking about cancer prevention, screenings, and also genetic testing to, basically prevent disease, cancer.
Yeah.
Okay.
Yeah. And so now I understand that you have opened a comprehensive boutique women's health gynecology practice, which is so amazing. Can you tell me a little bit more about this innovative venture that you've started?
So the practice was sort of built on, as I said before, I was in the office, several days a week. And then I also I didn't mention this, but I was on call 24 hours, 1 day a week, every week. So, not doing obstetrics actually eliminates that call day, where I'd be delivering babies and also doing my gynecologic surgeries. So the new practice is actually, it was sort of born from all the things that I saw that we were starting to lack in healthcare. And in my private practice, I took insurance, and it was under an insurance-based model. And, you were really dictated how much time you could spend and what you could do in the office at a patient visit by the insurance companies. And so, but it was never enough time. 10, 15 minutes is never enough time for any sort of visit. So I felt like I could take care of people in the way that I was trained, and also the way I believe people should be taken care of, by starting my own practice, which gives people a little bit more time with me. And I think the other thing is, I spent a lot of my day advocating for my patients. So, whether it's a new breast cancer diagnosis and getting them in to see a radiologist as well as a breast cancer specialist, making phone calls, things like that. Those are the things that matter, in terms of, and it's really hard to navigate the medical system as a patient, and I know that as a patient, as a doctor, right? So, and so, I spent a lot of time doing that, and I think that's going to be helpful in this new practice, to have a little bit more time with someone to talk to them about the things we need to talk about, and the things that they want to talk about, and also with, helping them navigate the medical system in general, should they need it.
Yeah. And so this really new holistic approach to care is really different from traditional gynecology. So what kind of led to this pivot in your career?
I think a lot of it was really driven by just the things that I'm passionate about, honestly. Like, I wanted to talk more about, preventive care. You don't get 10, 15 minutes is not enough time to talk about, breast health, about your gynecological health, different solutions, and also explain. I think we live in a world now where information is so easy to get. And you need someone, if I could get my, doctorate, like my MD over Google, that would be great, but I paid good money for that degree. And so I think that, I think you also need someone to help you interpret that data, and to sort of talk you through, what you read online, and how that fits, and, sort of come to a collaborative sort of, space with, when you're taking care of someone. So, that's what sort of led to this, and also this sort of shift in my career. And also because taking care of the whole person is really important. This does not discount, internists and primary care physicians, because I think they're fabulous. And I tell all of my patients they need to have me, but they also need to have a primary care doctor, like a gatekeeper. But there's a lot that we do in gynecology that is primary care, and, but that does not replace your primary care physician or your internist. So, it was just a way of sort of making sure that I can take care of people, and and they feel taken care of, and like not just a number.
I really love that. And so I guess you kind of talked a little bit about this, but what do you really enjoy about your work life or career, and what kind of drives you every day to get up and go to work?
So, I mean, I think going into medicine in general, if you don't love it, it's going to be a chore, right? Just like anything else, because it's not easy. It's hard, but I get to wake up and, especially doing this for about a decade in this area now. I mean, I have patients that I've known for 10 years, so I'm excited because I get to see them at least once a year, usually more. But I mean, I get to get up and I get to talk to them about the new things that are going on in their life. I get to really make that connection, right? And also lead them through potentially difficult, times in their life, whether it's a difficult diagnosis, or even in obstetrics, like something unexpected that they, just didn't anticipate throughout the pregnancy. But it's just nice to be able to like help people, establishing that like connection, and also that relationship is really important, and obviously the trust, so like that's what gets me up and gets me going. I like fixing things. I can.
So a little bit on the other hand of that, what kind of frustrates you about your career or your work?
Well, I think right now there's a lot going on in women's health that is controversial, and but I would say in general, I think the most frustrating thing is the barrier to good care, or barrier to medicine from parties that don't really understand what you're doing and why, or like the prior auth, answering to like an insurance company as to why we think this is the best route to go. I think that's more of the frustrating thing. It's also a large part of my job. Like social media is fantastic, and I think the ability, like I didn't grow up in an era where we could Google things as readily. I mean, I did, but not when I was in high school, at least. And so now my teenagers, my like all of my, I see everyone from like adolescents to postmenopausal patients. And so everybody has access to so much information. So, I mean, it's really, I just want to make sure that it's the right information, we're having a discussion about that.
Yeah. And on to that point, I guess what are the common misconceptions or myths people have about gynecology that you wish you could clear up?
That all we do is deliver babies. That's one thing. I think people don't realize, like, so we do a lot of surgery. I do, I used to do obstetrical surgery, which was, wonderful. It was wonderful chaos in a sense. But we also do gynecological surgery. So there are minor procedures and major procedures, involving things like removing a polyp from a uterus, or as basic as, following up on abnormal pap smears, to doing a hysterectomy, right? So, it's interesting how many times, you would be the one counseling someone about various surgeries, and they would ask, who's going to be the surgeon? It's like, well, that's me. That's me. But I think, that's one of the bigger misconceptions, is that's delivering babies is all we do, and it's definitely not. Talking about sexual health, contraception, menopause, perimenopause, bone health, nutrition, those are all big things in gynecology that, we really should be addressing, but sometimes don't have the time to. Depending on the business.
And so how has specializing in a field focused specifically on women's health shaped the way that you approach patient care, particularly when dealing with like different life stages like adolescence, pregnancy, and menopause?
I think, it wasn't, I love the variety, and I think that anybody that goes into obstetrics and gynecology actually has an element, about them that really does like we do a lot of different things, but I mean, I think in terms of, the different life stages, I mean, I like meeting people where they are, and it's about being intuitive and sort of, understanding that maybe if you see someone that's a teenager, they might not be as comfortable, especially with their first visit to a gynecologist, being undressed and on a table in a somewhat cold room if this is your first visit. So it's about like understanding what's important, what we're going to get out of that visit, right, in particular, and whether that's actually even necessary, at least the first time. I think it's about establishing trust in a relationship first, right? Whereas some people that have I've already seen or that know me, like that are in their 30s, 40s, 50s, 60s, postmenopausal, like it's about addressing, and I'm meeting them on a completely different level, in a different way, and addressing their issues, but it's a completely different conversation and level of comfort too.
Yeah. And so given that gynecology and women's health have historically been having less research and funding compared to other areas of medicine, how do you think this has shaped your career as a gynecologist? And what challenges or opportunities does this lack of research present in providing the best care for your patients?
Well, the current climate notwithstanding, I think that in general, women's health, it's changing. I mean, I think in the past few years, especially, we can see with the, I would call it like the menopause revolution almost, people are taking charge and really examining the data again. And, I think that hopefully in the future, we will continue to that train of like, and that, I hope that steam doesn't run out because there's so much more work to be done. I do think there are wonderful people in the field that are ready to do it. It's just about funding and time. Right? Especially time, because you need time. I mean, the WHA was done a long time ago, and now we're re-examining, sort of the benefits of the Women's Health Initiative. And there's a lot of room for improvement, with women's health and sexual health.
And so throughout your career, you've really navigated a lot of different paths. Are there any expectations that you had maybe going into your career that turned out to be completely different from reality?
This might sound, well, I was gonna say, I think I thought that I would have, I thought residency was gonna be the hardest part. Right? Because traditionally it is.
You see it on Grey's Anatomy.
Exactly. You see it on Grey's. I mean, those aren't, but at the same time, I think time management and really being able to leave work at work and then come home. I think that was the most surprising thing, because I mean, as a resident, your work is your life. Right? Even though I had a baby in residency, it was still like, he was young. It was, a little bit easier because he was that young. But as an attending and being in private practice, I think that leaving work at work was really difficult, difficult to do. Because you can always log in and look up a lab, or like, my patients, some of them have my cell phone number, so they call me or they text me, and it's hard to say, to draw that line. So making boundaries is as through the years I found is difficult, but it's also necessary.
Now for my final question, what's a piece of advice you would give someone who wants to be where you are right now in your career?
So, my advice would be a couple things. I mean, I would say definitely remember your why, like why you want to do this, and if you love what you do, it's never a job, right? It's never a chore. Also, and I think I mentioned this before, but stay humble, but stay curious, right? Like lifelong learning is, I mean, it's a phrase that we use all the time, but it rings true in medicine. Like you're going to always want to keep reading, keep exploring, because new things pop up all the time. And so, being patient-centered, but also remembering like this is not just a job, it's a calling, but it's a calling because you're not freezing information in time. You have to keep up with all of the new stuff and And that's really important when you're taking care of someone. Like, I try to treat all my patients like they're like how I would want my family member to be treated, right? And if you see a family member in each of your patients, then that sort of guides you as to like how you should be, how you want to behave and how you want to take care of people.